Today, the Select Subcommittee is holding a hearing to examine the role of both infection-acquired or natural immunity and the therapeutic acquired or vaccine-induced immunity. It should have and could have played in the public health response to the pandemic, and concerns as to why the federal government decided almost wholly to ignore at least the natural immunity. In the earliest stages of the pandemic, COVID-19 was a novel virus, and there simply was no data. Again, we are not here to negate the significance of that unprecedented time. But as data changes, so must our decision-making based on data. And as time passed, more and more global research emerged that infection from COVID-19 produced robust, naturally acquired immunity. Let's be absolutely clear. Natural or infection-acquired immunity is real. It's been known for hundreds, if not thousands, of years. Dr. Fauci himself even said so in 2004. While speaking about the common flu, he said, quote, "The most potent vaccination is getting infected yourself," end quote. And yes, the flu and COVID-19 are different, but the science regarding immunity is the same and should be respected. However, instead of following the science, public health leaders ignored the facts and mandated vaccines for Americans without any regard for a previous infection and immunity that may come from that, and did so with the threat of losing one's job. Nowhere in this process was there an opportunity for one to confer with their doctor, who they know and trust, to discuss risks and benefits to their health. This is part of the reason we are here today, to ask why naturally acquired immunity was never robustly considered as part of U.S. public health policy, to ask why science wasn't followed. It's essential that we look back and examine the policy decisions that were made. And at the end of the day, science and scientific facts are not political. For a democracy to be healthy, it needs to be transparent. And a transparent, healthy, and free nation does not shy away from the facts. When the COVID-19 vaccines became widely available, 91 million Americans had been infected with COVID-19. Still, facts and science continued to show that those who had antibodies from previous infection had some form of protection against reinfection. Yet, the Biden administration attempted to mandate vaccines regardless of previous infection for the military, healthcare workers, large private sector companies, and federal employees. All around, this is bad public health. Between the mandates and the vitriol showed towards natural immunity, these decisions hurt Americans' trust in public health, a trust that we hope to restore at the end of this process. To be clear, no one ever advocated for a let-it-rip approach. No one ever advocated for natural immunity to be the end-all public health factor, just that it was to be considered. Natural immunity could have been, and I believe should have been, a force multiplier for good. We could have used thousands of years of science to our advantage, but instead it was demonized. This should have been part of a conversation between patients and physicians. And I'll share a personal story. I got vaccinated with the Pfizer vaccine in early January, February of 21, with so many other Americans, especially Americans my age and older and with comorbidities. In August of 21, I realized I must have had COVID when I was cooking and could not smell garlic salt. I was fine, my family was fine, including my 89-year-old mother. All that being said, when I was scheduled to go on a trip to Germany, I was told I needed to get boosted. And so I asked if here at the Capitol, if I could get my T cell count and my antibody levels before getting boosted. I was told that they couldn't do the T cell through their lab, but they could do the antibodies. I got my results. On the results, it says that a number of 40 confirms the presence of circulating IgG antibodies specific for SARS-CoV-2 at high levels. At high levels, 40. My number was 821. Yet I was being told, not by a physician, that I needed to get a booster. Why? No doctor involved. See, public health needs to be educational, not indoctrinational. Why were personal medical decisions left up to bureaucrats and the politicians, not patients and doctors? I do believe that vaccines saved innumerable lives. We knew from the trials that mRNA-vaccinated people still got COVID. They, in most cases, did not get as sick and were less likely to be hospitalized. We know that people with certain comorbidities were more vulnerable to severe illness and death. Why did bureaucrats and politicians mislead and confuse the American people? At a town hall event on July 21, 2021, President Biden stated, "If you're vaccinated, you're not going to be hospitalized, you're not going to be in the intensive care unit, and you're not going to die. You're not going to get COVID if you have these vaccinations." After the town hall, he stated to a reporter when asked about vaccinated people who get infected, "It may be possible. I know of none where they're hospitalized in ICU or have passed away. So at a minimum, I can say even if they did contract it, which I'm sorry they did, it's such a tiny percentage and it's not life-threatening." In May 2021, when asked about new CDC guidance for vaccinated people and masks, Dr. Walensky said, "Data has emerged again that demonstrate that even if you were to get infected during post-vaccination, that you can't give it to anyone else." On March 29, 2021, Dr. Walensky told MSNBC, "Our data from the CDC today suggests that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials." The director added, "But it's also in real-world data." Spokesperson for the CDC had to walk back their own director's statements a few days later, telling the New York Times, Dr. Walensky spoke broadly during this interview, adding that it's possible that some people who are fully vaccinated could get COVID-19. The evidence isn't clear whether they can spread the virus to others. We are continuing to evaluate the evidence. At a White House briefing on April 23, 2021, Dr. Walensky offered, "CDC recommends that pregnant women receive the COVID-19 vaccine. However, the CDC did not recommend that pregnant women receive the vaccine. It only stated that pregnant women can get the vaccine." While small, those are very different statements. On February 3, 2021, in a White House press briefing, Dr. Walensky stated that schools could reopen safely without vaccinating teachers. She said, "Yes, ACIP has put teachers in the 1B category, the category of essential workers, but I also want to be clear that there is increasing data to suggest that schools can safely reopen, and that safe reopening does not suggest that teachers need to be vaccinated in order to reopen safely." That time, the White House attempted to distance themselves from Dr. Walensky, with the press secretary Jen Psaki stating that Dr. Walensky was speaking in her personal capacity. The Biden administration and CDC's false narratives about the necessity and efficacy of COVID-19 vaccine and booster misled the public with scare tactics and deception. These statements fostered a lack of public trust in our health authority during a time when the American people needed that leadership and that truth and that trust the most. We're holding this hearing today to look back, to help prepare for a future pandemic, to determine what went wrong, to recommend how to do it better. Asking about the reluctance of the public health elite to consider natural immunity is essential to this question. That's what this hearing's about today. Science is clear. While for some, no amount of protection may be enough. However, natural immunity is real, it matters, it should have been studied, and it should have been considered fully.